So good afternoon, everyone. My name is Tom Palangi. I am the current chapter president of IFMA Boston. Thank you for joining us virtually and for joining us during your lunch hour here. This is a new well, not so much new format, but a new time and an approach to our events, as you've seen. I don't know if you've heard, but there's a pandemic. Yeah, so this is throwing a wrench in everyone's plans, clearly. But fortunately, we are here for our members, and we have had a lot of requests from our core membership for programming ideas and for conversations and just for the opportunity to share ideas and kind of talk to your peers about what is going on. So bear with us if this is a little glitchy. I think we're all learning, but this is now our third or fourth Zoom program that we've done really in the past month and a half. And we will continue to do this and adapt as we need to, as you folks all are doing. That being said, we're going to do something kind of cool. We're going to do breakout rooms for the first few minutes of this initiative. And it's randomized for the most part, but what we will do is we like to start our programs out with an interactive component. So that you're not just listening to a lecture the whole time. So what we will be doing is Janessa is our executive director. She will be the Wizard of Oz behind the curtain for us. And what we'd like you to do is when you get into your breakout room, it'll be probably about 5 to 10 minutes or so. We'll see how the conversations are going before I kick it to Tim and the discussion. But what we'd like to do is in your small room, give your name and your company, as well as your individual, very briefly, opinion on the biggest challenge that you see as we as a collective group face going back to work in the physical workplace. So the topic on today, in your quick answer as to what you think the biggest challenge will be. And then we'd ask each group that you have to identify one person that can just speak up in the larger conversation on behalf of your small group to say, okay, this is the consensus of our group. And obviously we only have 5 to 10 minutes, so it doesn't have to be very long, but just to kind of get a better sense so that Tim can lead the discussion based upon what the group is saying. So with that, Janessa, you want to shake us out?
Yes. All right. Did that work?
Yeah, it worked. We're back. At least our group is back.
Excellent.
We're apparently rule followers, Tom.
And was that enough time?
I think so. We could always use it, but
well, yeah. Now everyone can talk all together as opposed to. So
we missed one person, Timothy Keene. Maybe he can tell us. He just started to speak when you brought us back.
I can, yes, and thank you. And I can actually start my video too. So I was asked to join today by my boss, Jamie Wilson, or he introduced me anyways. I'm actually with Ask Cody, and we're a room and resource scheduler, so platform where we're actually been having a lot of conversations with our clients and prospective clients on them going back into the office. So this is actually really great for me to be on here too, to see what you guys are dealing with, and then maybe I can even help them out too with that. But some of the things that we're seeing is, as far as returning to the office, what's going to happen, right? As far as things like visitor management and trying to make that touchless, right? Or even just with your meetings, then scheduling cleaning after the meeting. So if you have a large meeting, you schedule the room to be cleaned as well after that meeting. So it's a safe environment for other meetings to come in, but they're also reducing the capacities for those meetings too. So we're seeing a lot of different things just to keep the office safe when everyone does return, but also different approaches too. We're seeing phased returns to the office. So if you can still work from home and do your job successfully, they're allowing some people to stay there. But then there's other components where some other employees can't, and they would be better served in the office. So they're doing a phased rollout of who's going to come back to the office and when. So we're seeing a lot of different things, and I can continue to share, but I'd love to listen to everything else that you're experiencing too. So.
And I think, you know, for quickly, we can do a quick little readout of what people were talking about in their breakout sessions. And I have a feeling there were probably some overlaps. You know, in our group, I'll kick off. The summary was really, you know, two major things. One is safety, but specifically, what does it mean to go back safely? You know, there's a lot of uncertainty about that. Some people have tried different things, and methods are many of them. You know, and it's just a matter of which are the right ones for your organization. So that was one of them. And the other piece was really just managing, you know, the uncertainty piece of how it's going to work in your environment, with your workforce, with your type of organization. So I'd be curious to the other folks, you know.
Tom, can you introduce Tim first, and then we can start
Sure, I can do that.
before we start doing the readout. And what we might want to do is, if each of your delegates could just add into the chat what your biggest concern was, and then I will feed that to Tim, and that's where we'll start off. And then everyone can
Perfect.
interject on what they've done. Sound good?
Perfect. So forgive my my reading from my screen here. I don't typically like to do that. But Tim, we're thrilled to have Tim leading our discussion here. Tim Bailey from Margulies Peruzzi. Tim is an award-winning architect whose leadership played a critical role in design of real estate development and workplace projects at MPA, or Margulies Peruzzi. You guys recently rebranded, right?
Yep.
An advocate for high-performance building repositioning, creative office space, and sustainable urban development. Tim is often leading large integrated projects, providing expertise on design as well as interiors. His work bridges the shared interests of both building owners and the users to create designs that successfully convey both parties' objectives. Tim is a member of the AIA, the BSA, USGBC, ULI, and a speaker on design insights and trends at real estate and design industry events. He's lectured on the topics of brand experience, creating a compelling and engaging customer experience, and recently on COVID-19 and the future of the workplace, which is obviously very close to what we're talking about here today. He's a patron of the arts and a philanthropist. He devotes his time to the local charities, including United Way of Massachusetts and Heading Home. He is an adjunct professor at Roger Williams University of Architecture, and he is a frequent participant and member of IFMA. So Tim, take it away.
Thank you for that. That was quite long, but yeah, thank you very much for having me. I'm thrilled to be here to not only share the information that I've been gathering from my conversations, but also hear what everyone is doing to be proactive in the return to the workplace.
And Tim, can you just talk a little bit about your survey and the report you've put together, which is why kind of we've asked you to be our moderator today?
Sure. So I've put together a report that emphasizes two things. The first one is we did a survey of over 500 people, those being OPMs, brokers, our clients, and our consultants, to gather some of the information as to, you know, what they missed from the workplace, how things are going to change when they eventually go back to the workplace. So I'll share that with you, as well as a little bit more of a digestible checklist of things that, you know, companies can look at as a starting point to give them some sort of guidance as they come up with a game plan to return to the office.
Excellent. And we will be sending that. You can get it on Tim's on Margulies' website, but I will send it to everyone after this meeting as well, so you'll have it. So
Yep. Our website is mparchitectsboston.com if anyone wants to go to the website. So I will share my screen. Just one moment.
And in the meantime, everyone can go ahead and leave in the chat what their hot items are, and I will feed those to Tim to start our conversation.
Do you want us to speak those, Janessa, or type them?
If you could type them, that'd be great.
Perfect.
Just so while he's going to do a little bit of a review.
Okay, can everybody see the presentation?
Mhm.
Yep.
Okay.
Yes.
Perfect. So this is the report that we put together, and see if I can, so going right into some of the results of our survey. The first question we asked people, what are you most excited about with returning to the workplace? Not surprisingly, 90% say they are looking forward to reuniting with their colleagues. You know, it's the emotional connection that people have with other people. So that's not actually surprising. But only 40% of people were looking forward to going back so they can actually focus. So people are actually able to focus on their job being remote. The second question was, in thinking about your return to the workplace, what are your concerns? 80% came back with, you know, safety within the common spaces, how to keep the bathrooms clean, kitchens, you know, how to deal with food service and, you know, the pantry type spaces that people have in their office. And from a policy standpoint, you know, a lot of people are concerned about, you know, pre-COVID, they didn't really have a work from home program. And I have a feeling that a lot of employers will now be, you know, re-looking at their HR stance on work from home policies as people start to come back into the workplace. And the last question that we asked people, what's the most important to the workplace when you return? 87% saying space to concentrate. Luckily, people have been able to do that, you know, quite successfully from home. And surprisingly, 73% of the people said that they can actually manage their teams remotely, which is kind of a shift in culture from, you know, the traditional thinking that people have to be in the office space to be able to work collaboratively. So, you know, platforms like Zoom have really, you know, Microsoft Whiteboard from an architecture standpoint have really been allowing teams to collaborate remotely quite successfully. And so now I kind of switch into the general checklist of the report. And these are a lot of, you know, some of them are low-hanging fruit and some of them are a little bit more costly to implement. This is just basically a guideline to see if anything, you know, pops into people's minds as to things that they can do to their office, from general office upgrades, you know, thinking about the restroom doors is a big topic, how to handle food service. You know, our company's bringing in a barista and you just grab your coffee and go instead of having a machine to make your coffee for you. The MEP improvements, you know, talking about sanitizing ductwork and UV lighting, which actually UV lighting has been prevalent in, you know, healthcare for a number of years to disinfect, you know, operating rooms and that sort of thing. So we've been fortunate to have a lot of collaboration during this COVID crisis with our healthcare studio and trying to bring a lot of the stuff that they do on the healthcare side into the office space. Because I think that pre-COVID, there was a little bit of a disconnect between healthcare design and traditional office design. And now I think you know, we're going to be able to learn a lot from, you know, how they handle, you know, hospital space and keeping everything sanitary and clean for those patients.
Excellent. So Tim, can we go ahead and, I know, how many more, I just want to make sure we get to everyone's discussion as well. So
Yep.
I now have kind of the running list with some of the things you've already touched on. So, but don't let me interrupt if you.
Yeah, I can go through this quickly because I think there's a lot of discussion to be had on these. And, you know, everyone can, you know, get a copy of this after and go through it in a little bit more detail.
Perfect.
You know, talking about screening and sensors, you know, how are, you know, people going to regulate temperature? What's that balance between, you know, safety and the health of the employees versus privacy concerns? Information technology, you know, do people have to increase their bandwidth to be able to, you know, their internet bandwidth to be able to, you know, take on more Zoom meetings? You know, getting away from those touch screen, you know, the technologies in conference rooms is something, you know, that companies should be looking at. This is a quick slide from an OpenPath webinar that I was recently on that actually gave some technology examples that companies may want to look into as they start to integrate back into the office space. So I go on between wellness, social changes. This has been a really big opportunity for a lot of the furniture companies to come forward with how to modify people's existing spaces with the existing furniture. Because I know a lot of people aren't going to go out and start, building, offices to be able to keep people private, because one, that's very costly, and we don't actually know what's going to be down the line in 18 months. So kind of taking the kit of parts that people have and moving things around to be able to keep that social distance is something that will be effective. HR remote work strategies, how that changes. And then we've also put together a bit of a checklist that's, what are things that you can do now as you prepare to go back? What are some things that you should look at, for the remainder of the year that might be a little bit more challenging to or costly to put in place. And then, thinking about the future, what does the future hold in terms of office design? Because it really takes a lot of the strategy that we've had in the past in terms of, that collaboration and that impromptu, meeting, and it's really kind of, turned it upside down. And so rethinking the office space is something that's on the top of my mind. And this is just a separation of a lot of these objectives, a lot into three, main buckets, being how to analyze your physical space in terms of your furniture, and, what percentage of people will come back in the phased approach for bringing people back into the office, how to handle, some of the behavioral parts of it, encouraging people to use the stairs versus the elevators, and the operational in terms of hand sanitizers, egress stairs, and cleaning solutions. And then to close that out, there's some questions here that kind of talk to what is the future, what's next, and a lot of these are open-ended questions that we'll hopefully get some answers to as time goes on. But that's a quick overview of our report, and Janessa, I will.
Yeah, so let me put out a few, I'll put out what kind of the group is for their consensus. And then at this point, I welcome everyone to interject on what your companies are doing and so forth. This is a full information share, and then Tim will also give insight on things that he knows just from what they've been doing. So I think, there's a million that we could do here. What about the concept on food service safety as folks are coming into the workplace? Just this whole idea, we talked about this when you and I spoke, we have all these bump-in spaces that we have created for collaboration, the coffee and so forth. What are folks thinking about for their, how they're going to handle food service when folks come back?
Well, I know for us, we're going to be suspending food service for the time being in all facilities, and separating tables in the break rooms, taking tables out of the break rooms, so there's less opportunity for social gatherings in the break rooms.
Is that, are you doing it in a way that people bring in their own lunches, kind of keep it at their own desk, not utilizing, a shared refrigerator?
Yes.
And then, yep.
Yeah, bring your own lunch. And what we might be doing is adding some small refrigerators throughout the facility so that people can put lunches within a refrigerator, but not a full size, home refrigerator or a commercial fridge.
Yep.
We've had our food service providers stop. Like I said, we still have 200 or so people in the building. There's no self-serve anymore. There and probably won't be for quite a while, if ever. No salad bar, no open food like that. Everything is prepackaged and is microwavable if it's a hot meal, or it's in coolers where you can just go pull one thing at a time.
We started working with our food vendor for the potential for like a pre-ordered sandwich or pre-ordered meal or a pre-ordered salad. They'd message you through our internal chat system when the food is ready, or you give them a time. And then you got to figure out all the lines from there and how to get up to the overall serving area. But similar to some other people, all of the mass food areas, like the buffet type food areas, are all going to be closed down. It's all single serve or bring your own, with adding a couple refrigerators on a floor by floor basis.
So then the same goes for coffee stations that won't have any of kind of, everyone brings their own, no caffeination during the day.
For now at Partners, we have brewers and hot pots. We don't have single cup Keurig machines. And right now we still are offering that. And we're, you know, I mentioned in our breakout room, where do you balance new protocols and policies against just human sensibilities? You know, how far do you go? So in our kitchens, people are still making their coffee, and not in all kitchens, but we should, now that I'm talking about this, there should be a Purell bottle on the counter. And so you make the coffee and then you either Purell or Clorox wipe the pump where you make your coffee, and just assume that people are going to look out for each other. But we haven't pulled any of it yet, Janessa.
Yeah, I'm hearing a lot of that as well. And, you know, there's going to have to be a certain trust factor of, you know, people in their fellow coworkers to be able to clean down these machines if they're going to be used, to be able to keep them safe.
Actually, on that too, it steps a little bit away from the coffee, but it goes to the unassigned seating and the flex seats, where the protocol that we're developing is for the individual that's there today. Because obviously there's a human error element, but the way the protocol is written today is that if I was sitting at a shared workspace today, we have the disinfectant wipes at all these multiple locations. That individual will disinfect, but then also the individual that comes in the next day, it's a different person. They have to disinfect as well. So the thought process is hopefully at least one of them does it. And in a perfect world, that workstation is going to get disinfected twice prior to anyone else using it. That's just something we're trying to implement.
We're doing the same, actually. We're setting up hotel space because we do have people who frequently come in, and we don't want to share desk. So we're setting up our conference rooms for single use hoteling and putting in disinfectant wipes, and just really counting on social responsibility to disinfect. We'd like them to do before they sit down and then after, similar to a gym. And then I'm the office manager here. I'll probably go in periodically and just disinfect it again, because it's that human factor. Will they follow up? Will they be as detailed as they should be to disinfect? So that's one of our concerns. And as time goes on, will people get lax and maybe, you know, do a quick wipe and not really the way it should be done? So,
yeah. In terms of number of people in the workspace, I know, you know, a few weeks ago we were talking about, you know, starting with 50% of the staff, and I've seen a lot of people actually going to 25%. I'm curious to see what percentage people are targeting in terms of having people in the office.
Well, for us, we have a lot of call center staff, and we have at least 2 call centers that will not be coming back to the office at all. They'll stay work from home. It's been very successful for us, and people are productive in a call center environment, so they'll be staying from home. Our CEO and senior VP have been, we've been working with them on putting a plan together to return from work, and obviously we got 6 states we got to deal with, but they're encouraging staff to continue to work from home. If they're comfortable working from home and they're productive working from home, then stay working from home for the time being. Obviously, the branches, we got to have a few staff back, but everybody else is being encouraged to work from home.
And that's one of the other things that I think keeps coming up, is just employee fear. Like, how, even when we are able to go back to work, how do we make sure that our employees feel safe to come back to work in whatever phased fashion?
It's a good question, and for us, we're taking it by location for demographics. So, for example, in Plano, Texas, it's nice. There's a huge 8-story parking garage. Employees park. They drive in, they park, and they go inside, and they feel comfortable and safe in the building. However, when you come to Boston, the feedback that we have heard is that they feel safe in the buildings. Class A, clean building. They take the public transit and the MBTA, and that's where we're starting to get our feedback. That's the fear, is getting to work and coming home from work. So it's not every location has the public transit system, but that's where we're getting our fear, because we can only control so much from people entering the facility. And then once they go home or the commute, it's going to be interesting to see what public transit does, because a lot of our employee population for Boston relies on that.
Can I ask a question? This is Craig. As you guys think about these, are you thinking about these as permanent changes, or is there some level of, like, this is an interim thing for 6 months or 9 months or 12 months? Where are people's heads on that?
Craig, this is Andrew again. Some of the measures would have to be interim. And where I say some of them, I don't think it's sustainable if we were to have 4 people in an elevator as we start to get further into the phased approach of 50% to 75% to 100 people into the office space, because we would have employees lined up down to the Prudential to get into the building. So I think at some point, and I'm not sure what that balance is, but I think from an elevator standpoint, we may have to, as more employees come into the building, I think that would be an interim. However, that being said, I totally agree. Some of these changes that we're doing will be permanent, similar to the shoe bomber at airports, why people still take their shoes off because of that one incident, or even some other incidents post 9/11 where there's protocols and plans in place because of that one specific incident. So I think some would be interim, and I think some of them are going to be, I know we keep saying the new normal, but I feel some measures that are put in place will be long-term, or just the way we do business.
Yeah, hey, Craig, this is Matt, and over at TripAdvisor, kind of the things we're talking about, in terms of, permanent or short-term, I think they really link to the difference between like capital asset upgrades. So security, touchless security, those kind of things will be permanent. But I think what's going to go away is, I think at some point we're going to have buffet food back. I think at some point we're not going to have one-way cafeterias. We're not going to have social distancing requirements being policed by individuals. Hey, can you spread out a little bit? Can you move further away? So I think we're looking at it as, are there capital upgrades that we can make in our future builds, or upgrades in our current facilities that can minimize transmission, right? Minimize person-to-person contact that would benefit for 5, 10, 20 years, whatever it is. But I think it's the social distance and stuff that will all be gone in 6 to 9 months, 12 months, 18 months, when all your herd immunity stuff starts coming in, right? And this is all well under control. I don't think the pandemic is permanent, but I think there's things we can learn that will make any future similar issue less affectable or less affected in the office.
So in thinking about what have people been doing in terms of putting together like a social distancing plan? Because, in our group chat, people have been talking about, coming up with graphics to make their employees feel comfortable enough to be able to come back to the workplace, showing, one-way paths, encouraging, use of stairs, to help take some of the pressure off of the elevators. So is everyone kind of in the middle of that now to be able to circulate from a communication standpoint to their employees?
I'll touch a little bit on this for my branches. So in our retail network, we've actually sent out a PowerPoint to all of our branch managers. We're installing hand sanitizer stations, some sanctions to allow clients to know how to process throughout our branch. We have floor decals. We've pretty much come up with a generic floor plan that we're sending out. We're not doing one for all of our branches, but it's a high level look into what return to branch life is like.
Yeah, we've gone through, we went through all of our, not just our building plans, but also branch plans, especially Rhode Island, because that looks to be the first state that's going to be reopening in our service territory, and highlighted workstations that are available for people to sit at as people come back to the office, but also taking the conference rooms in the meeting space and designating them as a one-person workspace. So we won't be holding group meetings anytime soon.
Yeah.
I have a question.
How are people dealing with, like what you were just saying about, okay, so if you look at a plan and these 4 desks out of these 8 desks on the plan are able to have 6-foot distancing if somebody were to sit at them. But are you then, if it's assigned seating, are you then dictating that those 4 people come into the office on Monday, Tuesday, Thursday from 4 p.m. to 6 p.m. or whatever? Are you doing the staff rolling back into the office based on the seating plans? How are people dealing with those types of challenges in assigned seating areas?
Yeah, I think people are having to look at it, not only from the physical distance that people are away from each other, but also what teams do people work in? Because I know my office, when we were looking at putting together a plan, we first started to look at, okay, this workstation can be occupied, this workstation can be occupied from a plan standpoint. But when you start to think about, okay, when you put names to those workstations, I'm like, well, the rest of my team isn't going to even be there. So why would I come to the office if my team's not going to be there? So there is a strategic component to looking at that at multiple levels.
We started talking about like a team 1, team 2, or somehow trying to split it up, and then just, Monday, Wednesday, Friday of week 1, team 1 goes if they need, right? I think one of the things, well, at least one of the things we've learned at Trip is we can throw our employees and everyone can work from home and we're still successful and we're able to complete the job. So there aren't many teams, there's not much feedback we're seeing in that, like, I need to get to the office to complete my job. So we're really pushing the local managers to say, when we open, can you have an A and B team? Can you have it's not A and B, people don't like that nowadays, a yellow and green team. So that we can spread it out. And even that, it's just yellow. If you need to go, you go on that day. Green, if you need to go, you go on those days. And so that automatically limits the people. Then unfortunately, we had a big layoff today. So we're kind of down 50% already. So we're, I guess then you got to just trust the people to, if 2 people that are there are in adjacent desks, that you find some social space or go to a conference room or go to a soft seat somewhere else and stay away from that, adjacent desk.
Yeah, there's been a lot of talk, even you're talking about, soft seating in terms of, furniture, in the corporate world, unlike healthcare, we use a lot of the plush furniture that's much harder to clean. So our company's kind of taking some of those pieces away to, kind of force people to utilize more cleanable surfaces, or, are you just taking, are you also taking, conference room chairs out of conference rooms to be able to, keep the distance and limit the number of people in a conference room?
I want to share that my manager actually did some CAD drawings, and he's shown that my seat in this cube, this workstation, is actually 7 feet to the person across the aisle. Okay, so there's at least 7 feet from my chair to that chair. There's also approximately 7 feet in this direction if I go over the spine to where that person's sitting. In front and behind me is again at least 6 feet. So literally right now, the way these workstations are set up, the 6-foot distancing is there. What comes to my mind though is kind of along the line of perception is reality. So where do we have seated privacy, so we don't have 66-inch panels for the spine. So, and we don't have any wing panels on this side of the cube. So even though the 6 feet is being honored, if people's psyche is, but I can look right over there and see you so close, and if I can see right over the panel, the spine, so how do you balance that? How do you just say to your staff, look, you guys are fine, we've proven it, we can show you pictures, we can post them, and them saying, yeah, I don't care, I still don't want to come back to work if so-and-so's going to be right over the spine and he's going to cough.
Yeah.
So I think in the under the heading of, man, nothing's going to be easy.
Yeah, and I think that's why I think that's why a lot of people are really embracing that phased approach and coming back to the office, because it is going to be a, wait and see kind of how it goes. How do people respond, when they start coming back? And, I think over time people will, start to feel a little bit more comfortable versus just seeing the plans that show those distances.
I agree, because even with allergy season, I'm sorry to interrupt, allergy season and whatnot, if somebody comes in and happens to sneeze or sniffle, is it going to raise that level of anxiety to anybody who's sitting around that person? I saw that right at the beginning when COVID hit, somebody coughed or had a little bit of what seemed like a cold. As office manager, people were coming to me saying she shouldn't be here, they need to leave, and trying to figure out how to handle that anxiety, not offend somebody else, but it's going to be treading lightly and trying to navigate that new fear that's going to be with people for a while.
And that I think segues into one of the other questions, which is the concept of this thermal screening, or what is your daily screening going to be for someone to enter the workplace, both from an employee standpoint, but also from a visitor standpoint?
We're trying to figure that out as well. I'd love to hear anybody's input for that.
I think it goes back to the trust factor.
Yeah.
It's really an employee self-survey as they walk into the space, because, they have to answer the questions honestly, whether or not you have a thermometer there and whether or not that's even going to matter if they don't have symptoms. But, I'm considering a survey, and if people come in 5 days, we're going to try and do staggering. But if people come in 5 days in a row, where are they going to do that survey 5 days, or do we have them do it once a week? What do we do? Or if just something changes, I think whoever said it's a trust factor, that's the huge part of it.
So what we did in our corporate spaces that we have badge access, any door that you would badge into for entry into our space, we put a sign up that says, before entering this facility, ask yourself these questions. Are you experiencing any of these symptoms? So once you attest that you answered no to all of those and you badge in, that's our record of you saying that you're well to come to work.
And even in our breakout group, I forget who it was, but I was talking about the idea of testing, and even that we can test negative on Monday, but then positive on Tuesday, right? Someone could walk in the office with no thermal scan, no issues, no anything, and if they're saying it's 30, 40, upwards of 50% of people are showing no symptoms that have it in some areas, some counties. I've gone through the gauntlet with my security team on all the different measures when it comes to upgrading our turnstiles to having vertical blockers, so it's one person at a time with an integrated thermal scanner. And if that's going to get me best case 50% accurate, that's not worth the $50,000 I'm probably going to have to pay to put the stuff in. So yeah, it goes back to until this thing is totally covered and there's a vaccine, there's always the risk of the asymptomatic person, which none of us can figure out without keeping offices closed. And then to the device level, it just depends on how much you want to spend and what you're really trying to get at. And, it's really tricky. It's really tricky. I don't know if there's a right answer.
Yeah, I was curious about the device issue. I'm sure people aren't going out and installing all of these automatic door openers and things of that nature. How are people, dealing with those door handles that, people need to be able to touch to get into spaces?
Well, for us right now, we're leaving a lot of doors propped open. And made a decent sized investment in door stoppers. So just so that people, other than the exterior doors of the building, everything's propped open. But for now, I work out of the Garden City office on Long Island. For now, there's only maybe 6 of us in the building. Some of the other buildings, there's even less.
Yeah,
there's a couple tools out there. Another vendor of ours or colleague of ours showed us something. It's basically a hook. It's almost like a carabiner. Yeah. It's a little bigger than a carabiner, and it has a hook and also has a pointed end to it, so you can push your buttons on your elevators. Mm-hmm. You can swipe your access, then hook the handle. It's an antimicrobial surface, so you don't have to worry about anything lasting too long on it. We were talking about potentially as like a reopen thing, throw our logo on it and consider it a swag, like, hey, thanks for coming back. This is just another way we can make you feel safe. Yeah, and on the safety thing earlier, real quick, our communications in the office and to our team, we've set up a number of FAQ documents that are accessible to everybody. And we're constantly responding to just the open.
We have extra custodians, day porters, and they are just doing loops around the building, hitting all the touch points, the restrooms. And we have a lot of the wave your hand and the door open, the touchless, but people still touch them. So they're just doing loops on everything they can, the Purell, the top of the pump bottles, everything, the tops of the chairs. But someone could easily come right behind them and touch something. So you can only do.
Yeah, in terms of, having people open the doors for you, as clients are looking at using the stairs more often, those are doors that you can't actually prop open because of the fire rating. So, when you start propping doors, just make sure that everyone is cognizant of the fact that, if it has a rating that it can't be, or it needs to be able to close, when the alarms go off. So.
Quick note, positive thing right here. To Matt's point he just made a minute ago, there will be IFMA Boston little widget things that he just described on their way to the folks that engage in our organization events. They've already been ordered. They were ordered, Thursday or Friday of last week, and they're really cool tools. It's a small thing, but
nice. Can you share where you got them if we want to get them for our office?
Sure, Janessa can do that. Reach out to her separately, or we can fill it out in a follow-up email.
I can put that in the email with the report as well. It's just our promotional products.
And they're pretty affordable, to be honest, especially if you buy in bulk.
Wonderful, thank you.
I got a quick question, Tim, if it's okay with you, just to kind of go back. There were a lot of folks talked about changing conference rooms capacity down to even, making them for one single person, or at least removing chairs. And I'd be curious to hear from the folks that are talking about making those changes to their conference rooms, just in terms of how they're going to enforce compliance with those significant changes. Just putting signs up outside the room, sending out a company-wide email, what are the methods for actually driving compliance for this new conference rooms?
Yeah, I think that what I've been seeing is, people would be putting up signage. But also, something I think I touched on earlier was, if it's a 10-person conference room, only having, 4 seats in the room. So if people go in there, there's no place to sit. And it's kind of a mental trigger that, you can't be that dense in the room.
Yeah, we started working with our signage vendor and just getting some simple stickers on the table. We don't have anywhere to put hundreds of chairs. I have 100 conference rooms in our building. We have over 1,000 chairs. If I split it in half, I don't have anywhere to put 500 chairs without giving up other space. So I think it's a trust factor, but also I think, again, with people nowadays, if you just put a sign in front of them and you remind them of what's going on, right? Because we're changing habits here. This isn't changing in a day. This is months of doing the same thing over and over again to create a habit. So I think we just went with the idea of signage, a simple X, big green X on that space on the table. And if someone sits in the chair, then so be it. I mean, we're not going to police and take your badge away so you can't come to work for a day. It's really a community that everyone needs to jump on board. The message needs to come from the CEO. Don't fuck around. Like, do this the right way. Follow the policy. My team's been busy as could be for the last 2 months. I'm an office experience team. We've been busier than ever trying to figure out a solution to keep 2,000 people safe. Mm-hmm. And the only way that the thing we've always come back to is the message has to come from Steve. It has to come from the top. It can't come from managers and local, and it has to come from the top and be reiterated. Is where we found the most comfort in considering reopening offices, to follow our plan.
That's like change management. You need to lead by example, right? If other people see their bosses behaving in the correct way, they're going to behave in the correct way. If they see their bosses doing the wrong thing, they're going to say, oh, it's okay to do the wrong thing. So I think it's important that everybody, tries to do it together. And if you see somebody that's doing something inappropriate, that it's okay to say to that person, hey, can you sit one chair over? Like, you're sitting too close to me. I think it's just being a good, steward and a good team player and trying to realize we're all in it together, right?
Excellent. Oh my gosh, there were so many good things that were discussed here. I want to be cognizant of everyone's time, that we have come to the 1 o'clock hour, but I will tell you that I will promise you this is the first of many of, this today was to kind of talk about all of what is perplexing us, and then we can dig deeper into each of these. We are going to bring in an engineering expert to talk about all the things that we didn't talk about here, which is like the UV, the HVAC, what are all the other components that's going to be our next one, and so forth. So we have more to come, and so forth. This was recorded. I'm going to dice out our beginning pieces and so forth, but this will be posted so you can share it with others. I will send you the report and the link, or the contact that I have for the
swag. The handle thing.
Yes.
Thank you.
The other thing to keep in mind, and this is something we'd like to throw in there, is that we're all going through this crazy new world together. And one of the things we were identifying at IFMA prior to all of this was that we wanted to diversify our content so that it wasn't always a live program in person. Turns out that was a pretty smart move we made a long time ago, but there's so many new tools that you can do. So we're doing a podcast series. You've probably seen FM Forward. That is being promoted now, and we're firing those out all the time. And this has really taken over the topic, and we're to be able to talk to a whole bunch of different experts. So if you have a topic or a question or anything that you come across, and you're just looking for more information, please reach out to me, to Janessa. ifma@ifmaboston.org is a great email address to send things to. Somebody will get back to you very quickly, and we'll find ways to present information. We do white papers, we do these, eventually we will do in-person things again. But there's lots of opportunities for you to get information and to interact with your peers.
And we will be also in the next, probably within the next 6 weeks, we will have, these are FM roundtable, or FM information shares, but as you can see, it's not all that, it's open to all, whereas we will have a thought leaders, which is just our FM members. So it'll be a smaller group coming up as well. So that was already needing to be, and so that'll be virtual as well coming up. thank you very much, Tim, also for all of your insight and helping in our moderation today as well.
Thank you. Thank you for having me.
All right, everyone. Well, best of luck. Stay healthy, and we'll be in touch soon. Thanks for joining us.
Excellent.
Thank you,
Time well
guys.
spent.
Take
Thanks,
care.
everybody.
Great to
Big
hear.
hug.
Take care.
Big
Thank
hug.
you.
It's down here, right?